So diabetes can affect many parts of the eye. It can affect the front of the eye, where there can be increasing dryness of the eye. It can also bring on cataract, and that's when the lens of the eye becomes a bit cloudy, and that can come on a bit earlier in diabetes. But predominantly diabetes affects the retina. That's at the back of the eye. It's a thin film at the back of the eye that allows us to see. When you have diabetes for a number of years, and especially if it's poorly controlled, the blood supply can slightly reduce at the back of the eye, and that results in release of growth factors into the retina, and that can cause changes to the blood vessels at the back of the eye. They can start off getting swelling towards the center part of the back of the eye, which can blur the vision in the late stages. And also you can start to get some hemorrhages and some changes which we call cotton wool spots at the back of the eye, which then can result in abnormal blood vessels to grow on the retina. And these can ultimately bleed into the back of the eye and cause problems with your sight, especially if it's left untreated. So diabetic retinopathy occurs particularly when the blood sugar is poorly controlled over a long period of time. This causes changes to the walls of the blood vessels and to the blood cells, which then affects the blood supply at the back of the eye. As the blood supply drops at the back on the retina, we start to see diabetic changes. Initially, there's just a few little hemorrhages or microaneurysms develop, and then later on, we can start to see abnormal blood vessels growing on the surface of the retina, and these can start bleeding into the eye and cause problems with vision if left untreated. We can treat these at an earlier stage to stop the bleeding occurring and to reduce the risk of any sight loss. Also, in the central part of the back of the eye, we can start to see leakage of blood vessels, of the small blood vessels at the back of the eye, which causes swelling towards the center part, and that can cause blurring of vision. Again, this can be treated to reduce the risk of sight loss. So often diabetic retinopathy does not have any symptoms, even with quite advanced stages of retinopathy. That's why it's so important to have your eyes screened yearly, either in your local eye screening program or by your ophthalmologist, especially if you have more advanced diabetic changes. Once retinopathy progresses to advanced stages, you can start to get bleeding inside the eyes, and that can cause black floaters in the vision. And if you have advanced changes in the macular area, the maculopathy, that can also cause blurred vision. But many patients can have quite advanced stages and not have any symptoms at all. It's much better to pick up the changes before they become advanced, which is why diabetic eye screening is so important, and having your regular retinal photographs is encouraged. So it can take several years for the diabetes to affect your eyes, but if the diabetes is diagnosed late or the control is particularly poor, then the changes can come on more quickly. But generally, we don't see diabetes for a number of years after the diagnosis. So diabetic retinopathy is a progressive condition, so it's unlikely to go away without treatment. If the diabetes, though, is very well controlled, especially if the diabetic and blood sugar is well controlled, and the blood pressure and cholesterol, then there can be some reversal of the early stages of retinopathy. We also know that with good diabetic control, you can actually slow the progression over time and delay the advanced changes. So the best treatment actually depends on which part of the eye is affected by the diabetes. So if you have early maculopathy or changes with the leaking blood vessels at the back of the eye, in some stages, in the early stages, just observation or good diabetic control is all that is needed. But if you start to get an area of thickening of the retina or swelling of the retina away from the center part, we sometimes apply some laser treatment for this, and that can be very effective. If the swelling becomes more central and starts to involve the vision and starts causing some blurring of vision, then we often recommend a course of injection treatments, which can be given very easily into the eye on a regular basis initially, which can reverse a lot of these changes and actually improve the vision. With regards to the retinopathy, If you just have early retinopathy changes, often, again, no treatment is needed other than just observation and good diabetic control. And once we start to see more advanced changes with abnormal blood vessels growing on the retina at the back of the eye, that's when we usually recommend a course of pan-retinal laser treatment. And that can actually help to reduce the risk of bleeding into the eye and stop the progression of the retinopathy further, and can reduce the risk of sight loss as well from diabetes.